Hi, my name is Kate Rouse, and this is my Windshield survey for Nursing 445. For my nursing windshield survey, I decided to choose two different communities on the Central Coast, one Santa Maria, California, and San Luis Obispo, California. Santa Maria is my low socioeconomic community, and San Luis Obispo is my mid to high socioeconomic community. General appearance. Both Santa Maria and San Luis Obispo are located on the Central Coast. San Luis Obispo is clean, safe, well manicured. It's both a tourist town and a college town as well. Boundaries of San Luis Obispo include a large mountain range on the north and known to the locals as the Grade, a small mountain range on the east and the west as well, kind of segregated. Santa Maria is a larger city that appears more rundown, more trash on the streets, damage to buildings, and is overall less well manicured. The boundaries of Santa Maria are also small mountain ranges to the east and west, and a river that separates its northern region. Agricultural land separates it from a small town to the west called Guadalupe. Neither of the cities really have any names for their neighborhoods or no real sub-communities. Housing. The age of the buildings in San Luis Obispo vary, but including both old and new construction. The area known as downtown has a lot of new construction. Significant growth has occurred over the last 10 years. The majority of the neighborhoods are single-family houses, except for the college area. They have a lot of dormitory, fraternity, and sorority type apartment housing. There are smaller lots near downtown with larger lots on the outskirts of town. In Santa Maria, there's both old and new construction as well, but the majority is old. One of the biggest differences in the area is that the majority of houses in Santa Maria are multi-family homes with smaller lots near the center of the city. So, signs of decay. San Luis Obispo area is very well maintained, very few signs of decay, little garbage, little signs of pollution, few abandoned and vacant lots. Many trees and plants in the yards are very well manicured, as you can see. Santa Maria, there are more signs of decay, much more. Trash in the streets, buildings falling apart, paint peeling on houses, and more abandoned houses and poorly maintained yards and vacant lots. People. Demographics and homogeneity. San Luis Obispo's population is 46,730. The majority of the population is white, at 72.9%. Estimated mean house or condo value was $530,947. The education level is significant difference is 93.4% of the population have graduated from high school, and 49.6% have a bachelor's degree. Mostly young white population that you'll see walking down the streets wearing trendy, more revealing clothes. Santa Maria, the population is 103,410. Majority is Hispanic at 71.7%. The estimated mean house or condo value is $234,000. Education levels, only 57.3% have graduated high school, and only 9% have a bachelor's. Mostly Hispanic families that you'll see speaking Spanish or Mixteco, and appearing less well kept. Health and lifestyle behaviors. San Luis Obispo had more people of average weight and more athletic builds. Many people were outside exercising, walking, biking, more for recreation and fitness. There's also very few fast food restaurants, actually a total of 3, and no drive-thrus due to a city ordinance. There were also many health food stores and gyms. There was no smoking noted during my time there either. In Santa Maria, I observed more people that were overweight. The only people walking or biking appeared to be doing it for a purpose, such as going to the grocery store, and I also saw many people smoking. Risk behaviors. Like I said, more running, biking, walking, more physical activity at each of the parks, less traffic in cars. Santa Maria, more smoking, as you can see in the picture, fast food chains. There was 3 just on one corner. And less physical activity, and also gang activity was noted at the parks. Services. Parks and recreational areas. San Luis Obispo, there's 19 parks, which one of them is actually a lake park that surrounds a lake near the center of the city. and lots of hiking trails, easily accessible throughout the city, as well as lots of areas for recreation. Santa Maria, there are 27 parks and playgrounds, also access to a lot of sports fields. There are community centers as well. The parks were not well maintained and did not appear safe, and the majority of people at the parks were hanging out rather than participating in sports. Transportation. In San Luis Obispo, most is personal vehicles. Fewer people use public transportation. I saw fewer people at bus stops. Easily accessible walking or bike paths. And there's only one major bus company, and then there was one Amtrak stop. In Santa Maria, there was many people at each of the bus stops and more frequent stops. Multiple bus companies, including ones for people with disabilities, commuter buses, and again, only one Amtrak stop. Health and social services. San Luis Obispo has 2 major hospitals, including a trauma center, 1 urgent care, an inpatient mental health unit, 3 nursing homes, a Planned Parenthood, and a homeless shelter. So this is an adequate amount of resources for that population. In Santa Maria, there's only 1 major hospital for double the population, 2 community health clinics, 1 public health department clinic, 5 nursing homes, 2 Planned Parenthoods, and 1 homeless shelter. Protective services. San Luis Obispo has 1 fire department with 4 stations, 1 police department, and as you can see, 59 officers. Santa Maria has 1 fire department with 6 stations, 1 police department, and 101 officers. Religion, both areas are primarily Catholic, as you can see, 68 churches in San Luis Obispo and 110 in Santa Maria. Education. San Luis Obispo has 9 public elementary schools, 1 public middle school, and 4 elementary and middle schools, 1 public high school, 1 private high school, and a state university and a public junior college. Santa Maria actually has fewer elementary schools with 7 public elementary schools, 3 middle schools, 2 private elementary middle schools, 3 public high schools, and 2 private high schools, and 1 public junior college. Stores and shops. San Luis Obispo is the majority of small local businesses downtown, with a few major chain stores kind of on the outskirts of the area. Santa Maria has a mix of large chain stores and many small local businesses. Many of the locally owned grocery stores have Hispanic products. They were a bunch throughout the area. Economics, business and industry, and major employers. San Luis Obispo, the #1 employer is retail, followed by education and food services. And the major employers are the downtown retail stores, Cal Poly, and the nearby power plant. In Santa Maria, agriculture is hands down the biggest industry of the economy, followed by retail and construction. Signs of wealth and poverty. San Luis Obispo, the businesses were very clean, well-maintained. Advertisements were large, lots of customers. There was a large homeless population noted in San Luis Obispo, though. And Santa Maria, the businesses were very different, falling apart, few customers, lots of graffiti, dirty inside, lots of abandoned businesses, as you can see, fewer products, and also a large homeless population. I went into a Vaughn's in San Luis Obispo and one in Santa Maria, and there were significant differences in the maintenance of the buildings. Health issues. San Luis Obispo, there's a large elderly population, so older adults plays a big part. Sexually transmitted diseases does as well in the college age population from Cal Poly and Cuesta, the junior college. Access to health services is huge, and mental health is also huge in San Luis Obispo. Santa Maria, some of the issues are the public health infrastructure, that there are not enough resources for the number and the increase in population. Substance abuse services are limited. Injury and violence preventions in relation to gangs is also a big issue, and family planning, in that these are multifamily homes with lots of kids, and the population growth is very dramatic. Community resources. Available in both communities, like I mentioned, hospitals, homeless shelters, public health departments, health clinics. Basically, the biggest difference is that there is fewer overall resources for the amount of people in Santa Maria. San Luis Obispo, community strengths is multiple hospitals with easy access, lots of parks, lots of recreational activities. The economy is doing well, and it's a well-educated population. Santa Maria is more culturally diverse, lots of churches, adequate police and fire services, the ag community, the agricultural economy is booming down there. And there's actually a health clinic in the high school, which is a big plus, and more public transportation. So the stakeholders I talked to, the key stakeholders in San Luis Obispo, one is Ashley, an assistant nurse manager of the ER. She commented on the significant elderly population and a lot of the problems lacking from access to healthcare. As you can see, there's some quotes from her. She states that the patients are higher acuity and just sicker overall. She also reported one of the major health issues relating to lack of mental health services. I also interviewed Jeff, the director of County Health Agency for San Luis Obispo. He reported the biggest problem to be lack of access to health services, especially mental health and substance abuse. There's a lack of primary care doctors, mental health facilities, and substance abuse programs. Most people end up in the emergency department or jail. We need to have a more holistic approach where the patient can see their doctor, psychiatrist, or substance abuse specialist all in one place. Population stakeholders, Justin's a resident in San Luis Obispo and is a firefighter for the local fire department. He reported that the excessive alcohol consumption plays a big role in the health of the community. He also reported that nursing homes seem to be lacking appropriate resources. Amanda is also a local resident and a small business owner. One of the things she reported is the increase in very high cost of living, and stated it is ridiculous how expensive it is to purchase a home or even rent. No wonder so many people are homeless. She also reported difficulty accessing health services in her own struggle to find a primary care doc. In Santa Maria, one of the key stakeholders was Maureen, a nurse manager of the ER. She reports one of the major health issues involves lack of access to care, drug abuse, and gang violence. She states many of the patients we see in the ER are there because of lack of access to primary medical care and prevention services. Chronic illness is huge in this community, and the residents are not able to manage without being established with the primary medical doctor. Bobby is a local resident and coordinator for the Abel Maldonado Youth Center. He works with children 12 to 17. He reports the biggest health issue he sees as poor nutrition. Families have limited access financially to be able to survive, and they're feeding their kids the most cheap processed foods. He also reports the language barrier plays a big role in limiting families' access to care. One of the population stakeholders is Karina. She's a resident and also a local ER nurse. She reports the biggest health issue as lack of primary care providers. She states there are very few primary care doctors, and also none of them are taking new patients. Even the people that have PMDs can't get appointments with them for months. Dina is another population key stakeholder. She is an officer for the local police department. She reports one of the major issues to be gang violence. She said there's been an overall increase in gang violence in the community, and the murder rate has doubled. She also reports how families are literally living on top of each other and identified drug abuse as a big issue. Reflections. This was a super eye-opening experience for me. Based on the statistics and demographics and resources available in Santa Maria, it doesn't seem like it'd be that much lower socioeconomic or even disadvantaged than San Luis, but it's very obvious just even based on the pictures driving through how the big difference in the socioeconomics. I felt very unsafe in Santa Maria and very unwelcome. I actually work in Santa Maria and spend little time there and would not live there. And here are my references.